My dear friends, today the topic is, what are the implants? How are they used today? And how are we gonna place them in different areas? What do we need to know? What are the different types? What are the options? And what are the important tips that we need to know how to take care after an implant and a crown is in place? Is this our only option? Well, now we have invited Dr. Vijay, who was a former director of the program of USC. We work together at the office, and he's gonna tell you all his experience, which is of 30 years in implant dentistry and the reconstructions. With you, here I leave Dr. Frank Vijay. Thank you.
Well, it's a real pleasure to be with you today. I'm looking forward to just giving you a little bit of insight into what's been, as of late, a popular treatment option in dentistry, and that's dental implants. There's always a lot of question as to what are they? And to go back in a relatively short period of history, if I were to mention to somebody, oh, you know, I'm missing one tooth, what can I do about it? Well, the common option at that point was to put a bridge. If we talk about bridges, a bridge has been done for thousands of years. If we look back in history, there have been all kinds of attempts at replacing teeth with different mechanisms, gold wires, and historically, it's fascinating. So we're well aware about what bridges do, but if you looked at a bridge carefully, it connects teeth. There's oftentimes you need to create a crown. You need to create space for a crown that maybe the tooth didn't need it. But what were the options at that time? Really, it was either leave the space, have a removable tooth, or you place a bridge. So as I mentioned, this is not a new concept. What became a new concept, and it became an option for treatment not that long ago, was to be able to place a prosthetic tooth, an artificial tooth, meaning an artificial root. So we're not dealing with a tooth. An implant is not a tooth. That's something you need to be made very clear, because even though at the end of the process it may look like a tooth, the root now is this. It's some sort of metallic structure, typically titanium. There are some newer ones made from zirconia, but they all look pretty much the same. They have some form of a screw. There's a thread, and it is eventually placed into the bone. The big difference between an implant and a tooth, we have a root, and that root is held into place by fibers. We call it the periodontal ligament. That gives the ability for the tooth to make movements. That means like a shock absorber. It's a reparative structure, so if there's minor damages down around the root, it can heal itself. It gives you the ability to feel. So when you feel pressure, that's coming from the ligament. An implant won't give you that. The implant connects directly to the bone. However, what's the big advantage? The big advantage is, instead of having a bridge that connects teeth, you're able to have, through components, that is the beauty of an implant, you have the ability to screw in components of different configurations, and now all of a sudden you have what used to be 3 teeth basically connected. All of a sudden now you have the ability to have them separate. Where's the advantage of that? Well, if these teeth never needed crowns, you leave them alone. If they needed crowns, well, why not put a bridge? Well, we do know what the average lifespan, statistically, the average lifespan for a bridge is about 10 years. What's the average lifespan of a crown? About 15. What's the average lifespan of an implant? And this is critical to understand the differences. There's the component where the bone comes in contact with the implant. There's also then the component where the crown for that implant comes in contact. You're talking about two different things. There's the lifespan of the portion that's within the bone, and quite frankly, we don't know what that lifespan is right now. It could be for decades potentially. What's the lifespan of the crown and the component that holds the crown onto that implant? Well, we're walking into an area now that we can potentially believe that it's the lifespan of the materials that we're using. Potentially the mechanism by which the components are connected to the implant itself. That means the interface. How stable is it over time? Because now you have to understand, this tooth is a mechanical replacement. It's not a tooth, even though it can end up looking like a tooth. Oftentimes it can be indiscernible from a tooth. It looks just the same. But understand that nature's best implant is the tooth. This being said, if all things were equal by today's standards, you should, if you are missing a tooth, you should be hearing as part of a treatment option something involving a dental implant. If you do not hear that, I would ask the question, well, what about that option? There's many times factors that can make a dental implant option difficult. Of course, when you're talking about an implant, you need bone. So it depends how long you're missing the tooth. It depends on how did you lose the tooth. Many times people wait too long and they end up having periodontal disease that causes a lot of bone loss. That can cause problems with your own bone being deficient. It could be cracks in the root. You lost a lot of bone because the crack ended up causing a large infection, so you had a lot of bone loss. The good news today is you have different ways of recreating bone. You can do bone grafting. So in the end, there are few contraindications. Not everybody's going to be a candidate. There's anatomical issues that I mentioned about the bone, but there's also anatomical issues depending whether it's upper or lower arch, because in the upper arch around the molars, you have a sinus on each side, which we're all aware of. When you catch a cold, you feel congested. That sinus has an impact on how much bone is in the area. On the lower arch, you have additional issues, and those are nerves. So you don't ever want to have an implant go into a nerve, because then that's going to cause potentially disrupted feedback from your nerve. So you can get tingling, you can get a burning feeling, or you can have total numbness. So when you're being treated, first of all, diagnosed and a treatment plan developed, it needs to be a thorough one. As simplistic as it looks, and what you may hear about, that you make a hole in the bone, you put a screw, and that's all you need to do. Only thing I can tell you is planning is everything. You need to have someone that has experience to be able to properly plan it so no other complications are developed. Remember, you want to have the outcome in mind, and you develop the plan going backwards. Planning, again, is everything. Here's an example of a patient where we could have placed a bridge here, but to keep teeth separate, an implant was placed. Here, a molar in the very back, there is no option for an implant, for a bridge. If this were A normal circumstance before the 1980s, in this country, we would not have been able to put a tooth back here for this patient, but now we can. And then at the end, it would be very difficult to say which one's the implant and which one's the tooth. So you create a method of hygiene. Bridges are difficult to maintain. Why? Because they connect teeth. And like I said, we're very familiar. Dentists and patients are very familiar with cemented bridges. But when you have a bridge, now you have to go in between and clean them. And if this is in the very back, and if you're not really committed to keeping this clean, they tend to fail. They'll fail from periodontal problems. You have to floss under that bridge. A part of the bridge can come loose. One of the teeth that help hold the bridge can come loose. Well, that's a complication. That's failure of the restoration. Who wouldn't want to have the ability to freely floss in between their teeth? It just makes life simpler. With an implant though, as I mentioned before, it's not a tooth. The mechanism of how it stays in your mouth is different than a natural tooth. The same bacteria that can cause problems with your natural teeth can cause the problems around an implant. The only problem is the way you start having infection around the implant itself is a very different process because the bone is connected directly to the implant. So to be aware of that and people not to go back for regular recalls, I don't quite understand that. For all the time, effort, and money that was invested into this tooth, why would you not want to maintain it? It's a very simple process. You can brush it, you can floss it, but there are things that can happen around an implant that you won't feel, like teeth, but different. So that requires a recall schedule. Don't miss it. Go back, get your teeth checked, get the implant checked. Just a normal, simple process. If a person were to do that, your quality of life is enhanced. If anything has happened in dentistry in recent times, I can't stress how dental implants have changed the lives of people, especially the people that have been missing all their teeth. Because now you can go from dentures that would never fit, they caused a lot of pain. But with the proper planning and placement, now all of a sudden you have a bridge that's supported by these implants, and you really feel like you're born again. You can eat, you can chew, there's no movement. You look great. It's been a tremendous, tremendous addition to what we in dentistry can provide our patients. But like anything, it all takes proper planning and ultimately the proper execution of that treatment. So I enjoyed this time with you, and hopefully we'll get some good feedback. Any questions that you may have, please submit them, and we'll try to get to them as soon as we can. Thanks a lot.